Good afternoon, everybody. Thank you so much for joining us for our HealthLinks webinar. My name is Michelle Hahn, and I am the Community Programs and Events Manager for HealthLinks, and I get the pleasure of working with our partners and the rest of our team to bring in presenters to provide you and your organization with some more tools and resources to help you build a culture of health, safety, and well-being for your employees. Today, our webinar will focus on leadership strategies in the workplace, and I'm really excited to be joined by my colleague, Dr. Natalie Schwatka. Natalie is an instructor here at the Colorado School of Public Health within the Department of Environmental and Occupational Health, and she teaches on occupational safety and ergonomics for our Masters of Public Health students and occupational medicine residents. And she's also a researcher within our Center for Health, Work, and Environment, and works on a lot of different projects, mostly related to small business, total worker health, organizational leadership and climate, and workers' compensation. Natalie is a very passionate individual and loves everything that she does, and she's an inspiration to our entire team, and we're very excited that she's here today. Welcome, Natalie. Thank you for joining us. Before I hand it over to you, I'm going to go over a couple of housekeeping items for everybody. So if you have all noticed, you are on mute. We're going to keep you on mute throughout the webinar so that we don't have any interference with our sound or any problems. So if you have a question throughout the presentation, feel free to type in the chat box or your question box. There should be a control panel on the right-hand side of your screen, and I'll field those questions for you and have Natalie answer them along the way. We are also recording this webinar so that if you have other colleagues that couldn't join you today or you want to listen to it again after we're finished here, we'll share that with you and you can watch it as many times as you want. And then we'll also send out a thank you email tomorrow with all the valuable information and resources that Natalie shares with us today. So with that, we're going to go ahead and get started. So Natalie, take it away.
Awesome. Thanks, Michelle. So like Michelle said, I am an instructor here in the department and also a researcher within our center. And I spend a lot of my time doing leadership-based research, leadership in terms of the owner of a company, senior managers, as well as the supervisor level. And so I'm excited today to be able to tell you a little bit about why leadership matters and some background on why, you all are familiar with the HealthLinks model, the organizational supports benchmark, why that's the most important benchmark, and give you some strategies, some 5 practical leadership strategies to help you facilitate culture change in your organization. And then conclude with a note about our Small Safe Well study. So if you're a Colorado small business and you're interested in learning more about these leadership skills and having someone from your senior management team participate in a more lengthy leadership training around the principles I'm going to talk about, I hope you will email to learn some more. So just some background on who we are, where I work. So I am at the Center for Health, Work, and Environment at the Colorado School of Public Health. We are one of 6 national centers of excellence in total worker health and one of 18 national centers for training in occupational safety and health professionals. And HealthLinks is a signature program of our center. And our mission is to advance health, worker health, safety, and well-being. So what I want to do is start by thinking about a business case for healthy and safe working environments and why that matters for your business. And I want you to think about what your top concern is for your organization in terms of health, safety, and well-being. I'm going to present some stats on the whole spectrum of safety to health and to well-being, and I want you to think about what your top priority is in your organization. So sort of the bad news generally is that we have a lot of occupational injuries, illnesses, and fatalities in the United States. Paul Lay from the University of California did a pretty well-known study looking at the burden of occupational injuries and illnesses and how much they cost businesses, workers, and society. And back in 2007, so this is about a decade old, he estimated that we spend about $250 billion a year just on occupational injuries, illnesses, and fatalities alone, with the bulk of that coming from non-fatal injuries. So cuts, strains, sprains, amputations, etc. The good news is that we're generally seeing trends for declines in these fatal injuries and illnesses. This chart here shows the fatality numbers from 92 to all the way to 2013, and we see this nice downward trend. The problem is there's still about 4,400 individuals who lose their lives at work every day. Some other good news / bad news is we see that there's a decline in the rate of non-fatal injuries over time. And so this chart here shows data from 2003 to 2015, showing that the rate has almost been cut in half. And right now we're seeing about 3 injuries per 100 full-time workers. So again, good news is not as many injuries or fatalities, but it's still an issue in a lot of workspaces, and I'm sure some of you have experienced that as well, either yourself or someone you knew or you worked with. On the flip side, there's also some concern in organizations around workers' health, their personal health and well-being. At the Center for Health, Work, and Environment, we did a collaborative study with Pinnacle Assurance from 2010 to 2014, where we asked Colorado employees what are their most significant health concerns. And as you can see in this figure, stress is number one. So about 60% of the people in our sample of about 17,000 employees here in Colorado said that stress over their finances was their top concern. About the same had an abnormal BMI, so that means they're overweight or obese. About half aren't getting enough sleep. About a quarter are stressed at work, and about almost a quarter have depression. So clearly, personal health and wellness is of concern in the workplace as well. And this follows pretty well with what we see at a national level. The National Small Business Association did a survey of small business owners, and they too indicated similar findings that psychological health and stress and well-being were their top concern, in addition to things like weight management, smoking habits, and whatnot. So what this shows us is that we need to figure out a way to proactively prevent these injuries, illnesses, fatalities, and these chronic health conditions in the workplace. And we aim at the Center for Health, Work, and Environment to help businesses with essentially the culture change process of helping businesses develop cultures of health and safety that support their workers' health, safety, and well-being. There's no one magic bullet to culture change. It takes time, but what I'm going to offer you today is some ideas about how you can leverage leadership to do this. And as you're all pretty well aware, since you're on a HealthLinks webinar, HealthLinks is our signature program at the Center for Health, Work, and Environment, where we collaborate with employers to build a culture of health and safety in the workplace. And the HealthLinks model is based on 6 benchmarks, the HealthLinks standard, all the way from organizational support to workplace assessments to health policies and programs, to safety programs, engagement, and evaluation. All of these benchmarks are essential for businesses as they work towards building a culture of health and safety. However, what we have at the top here, organizational support, that's the most important benchmark. It's the most heavily weighted benchmark in our assessment. So if any of you have taken our assessment before, you may recall the kinds of questions that are in there. And we believe that it's essential for businesses to focus on organizational support, because in reality, all of these other efforts won't be as effective if you don't have support from the organization for them. So the organizational support section of the HealthLinks assessment covers all of the items that I've listed here, all the way from leadership to support, to identifying who the champions are in the organization, to knowing what kinds of dedicated resources there are, benefits offered, is there a health and safety team, and is the team working together to protect and promote employee health, safety, and well-being. I'm going to dial in up here on the leadership support section, which measures things around how senior leaders are communicating their values. Are they role modeling? Are they providing resources? So there's a lot of literature on styles of leadership and how it relates to employee health, safety, and well-being. And I've attempted to summarize everything that I've learned from the literature on this one slide. But basically what we have here is that on the y-axis, we have positive company and employee health and safety outcomes. Up is better. On the bottom, we have a more active style of leadership. To the right is better. And so the idea is that leaders should be using leadership skills to be proactive. And so at the bottom end of the scale, we have the worst kinds of leaders out there, abusive leaders. The literature tells us that abusive leaders who make fun of their employees, yell at them physically and verbally, assault them. Those kinds of dramatic practices actually, and you probably might not, be surprised, are related to poor health, safety, and well-being outcomes. Imagine if you were made fun of for taking the time to put on your personal protective equipment. Would you be motivated to wear it in the future? Probably not. But in the middle, we have some leaders who aren't, they obviously aren't too nefarious or mean, but leaders who necessarily aren't the most effective out there. And these are passive leaders, so they're laissez-faire, and they only react to health, safety, and well-being if it becomes an issue. If someone becomes injured, or if someone has to take extended leave for stress at work. But we also have inconsistent leaders here. So a lot of times leaders at work will sometimes be really awesome. They'll be really inspirational, but then sometimes they'll, fall back down the line when priorities become an issue. This sort of inconsistent style of leadership is also related to poor health, safety, and well-being outcomes. So the idea is when we use leadership in the workplace to influence health, safety, and well-being, we have to be consistent. We have to be always leading by example, always working to ways to inspire employees to be a part of the health, safety, and well-being program, coaching and teaching individuals to make sure they understand how to be involved, in the safety programs or worksite wellness programs, and recognizing them for when they do participate. So what I want you to keep in mind as I go through some leadership practices, I want you to think about your own workplace and what are your leadership priorities in terms of total worker health, which reflects health, safety, and well-being in the organization, and how can you apply the leadership practices that I'm going to talk about to your workplace. So there are 5 total worker health leadership practices that we teach here at the Center for Health, Work, and Environment. The first one is being a passionate advocate. Second is providing a supportive work environment. Third, being a role model. Fourth, encouraging growth and change. And fifth, expecting and recognizing success. And I want to note that the leadership practices here that I have here aren't reinventing the wheel. There's a lot of leadership theory going back decades, and what we've done is looked at the theories, integrated them, and repackaged them in a way that reflects leadership for worker health, safety, and well-being. So as I go through them, if you're familiar with leadership theories in general, you might notice something you recognize. So the first practice is being a passionate advocate. And it starts really with knowing what your values are. Why do you care about health, safety, and well-being? Why are you motivated to be healthy and safe? And once you know that, communicating that, making sure other people know that you value it. And it could be as simple as incorporating it into mission and vision statements that people hear about when they're onboarded, or when people go through training or used during external communications. And it really involves a degree of openness. So some key strategies to be a passionate advocate involves first doing some work to understanding your own values for health, safety, and well-being. And once you've identified your own, figure out ways to identify your employees' values. Why do they care about their health, safety, and well-being, and aligning those values. And once you know that, most important, communicate those values. Make sure someone hears about it. That could be informally when you're chatting with people in the hall or during lunch or during meetings, but it could be something formal, like I mentioned during the onboarding process or during annual meetings or quarterly meetings. Once you have those values set, think about the vision. So what's your vision for your company's health, safety, and well-being of its employees in 1 year, 5 years, 10 years? Set that vision and then share it widely within your company. The second practice is providing a supportive work environment. And this is all about teamwork and a recognition that maybe you're the health and safety leader in your organization, but you obviously cannot do it alone. And your program won't be as successful if you do it alone. So the idea here is to create a sense of teamwork and employee development, allowing employees to learn why health, safety, and well-being matters, to participate in safety trainings, for example. And then this really involves a lot of listening and using active listening skills. So listening intently to what people are telling you, what are their needs, what are their concerns, what are their ideas, you know, looking them in the eye, not checking your phone or checking email or doing paperwork, being active listeners when someone's talking to you about what they need. And this involves being respectful and authentic in how you're interacting with people and displaying a genuine concern for health, safety, and well-being, and a genuine desire for them to participate in the process of creating culture change. So some strategies for providing supportive work environment include, first, building a sense of community. And you know, everyone's there at work to get the job done, everyone has their tasks that need to be done. But I think the more that you can do to help people get to know each other on an individual basis and help people build a sense of community and support, whether that's through, you know, activities at lunch or going on walking meetings to take a break, or, you know, annual fall gatherings, whatever it is, to help build a sense of community amongst your workforce is key. The second thing is listening to employees' ideas and concerns. You know, everyone knows their work best, and so the more you can do to elicit feedback and ideas from everyone in your organization around what's needed for health, safety, and well-being, the more successful you'll be. And honestly, the more motivated they'll be to participate if they know they're involved in the process. And that really includes sharing responsibility, knowing that you can't do it alone. This fourth bullet point I have here is very specific to work-life balance. And I think in every company, regardless of what industry you're in, work-life balance is a huge concern. And so I think the simplest thing that you can do is to establish expectations around what does work-life balance look like in your organization. Maybe it's we don't answer emails after 7 p.m. so that everyone can go home and have dinner with their family. Establishing those expectations and holding everyone accountable for that. The third strategy here is being a role model. And some of you may be wondering why I decided to put role model as third. I did it very intentionally because I don't think that you can be a role model in your organization for health, safety, and well-being if you don't first understand why you value health, safety, and well-being and become that passionate advocate, and then don't, second, provide a supportive work environment that provides opportunities for everyone to act to enhance their health, safety, and well-being. And so being a role model here, really, you know what your values are, you know you value health, safety, and well-being, and you stick to it. You're always walking the talk, your words and actions are consistent. And some ways to do that include sharing stories. A lot of really effective leaders out there are really good storytellers. And so the more you can do to think about ways that you can tell other people about your own health, safety, and well-being goals, and put that in the context of your values and why it matters to you, the more successful you'll be at conveying why health and safety matter. Second, obviously, being consistent in your actions, both verbally and in your behaviors. Fourth, encouraging growth and change. This is all about risk-taking. So maybe you have been really interested in doing X, Y, or Z program for health and safety or for a worksite wellness program. Here, good, effective leaders will take that risk. They'll think about innovative ways to engage their workforce in health, safety, and well-being. They're open to a change, and they take that risk. Maybe it doesn't work out, but good leaders here, effective leaders, will learn from that. And they'll have an established evaluation process in there to make sure that if it fails, there's a way to learn from that mistake and move forward again. And to some degree, this piece of leadership requires some resiliency. You know, not everything is going to go your way 100% of the time. And as long as you have that plan to learn from it and move forward, you can build up a little bit of resiliency. So some key strategies for encouraging growth and change include, again, asking employees for their opinions on how employee health and safety efforts can be improved. A common theme among these leadership practices is employing others in your strategies to build health, safety, and well-being. And oftentimes, employees, you know, they know their work best, so you should ask them for their ideas and their opinions. And they may have thought of something that perhaps you hadn't thought of before. Second, take risks and experience with innovative methods. And third, like I mentioned earlier, set expectations that will evaluate our health and safety efforts and improve based on that evaluation. So this is all about taking the risk and having that feedback loop of learning and then moving forward based on what you learned. The final skill is expecting and recognizing success. And this skill is, in a lot of the leadership trainings that I've been involved in, often the most easiest to understand, but oftentimes the one that's most overlooked. And this is all about setting expectations and believing in people that they can actually meet those expectations. So thinking back to that fourth practice around taking risk, so you take a risk and you set the expectation that, hey, I think we can all make this program work, we can do it, let's do it. And then holding people accountable for program success, giving them feedback when it doesn't work so well, giving them recognition if it does work well, and it exceeds your expectations. And just this idea of celebrating wins, taking time to say thank you. And so the key strategies for expecting and recognizing success include, first, like I mentioned, communicate those positive expectations. Believe in people that they can participate, they can make it work, or whatever the initiative is. Giving feedback to employees, give them constructive feedback to help them learn, but also welcome feedback from other people. Have an open door policy where anyone could come in and give you feedback on how you're doing as well, or how the program in general is going. Third, specifically give feedback and recognition to people who are leading health, safety, and well-being, and recognize them for their efforts, both informally with them and on a company level, so that everyone knows that you value what they're doing. And finally, display appreciation for employees as they work towards their participation in the health safety programs. So I hope when I went through each of these 5 practices, you were able to think about what your total worker health leadership priorities are in your organization and how you might be able to apply them to your workplace. I'm happy to talk about each of these skills offline if you have any questions. But the next thing that I wanted to chat about during the remaining time that I have with you is our small business study. And for those of you who are here in Colorado and who have a business that has less than 500 employees, we are enrolling businesses into our Small Safewell study, which is part of our National Institute for Occupational Safety and Health Total Worker Health Center of Excellence grant. And the idea behind this project is really to understand what small organizations are doing to support the health, safety, and well-being of their workforce, how their employees actually perceive their workforce health and safety cultures, and what's the ultimate impact on health outcomes. And let's see, there we go. What this involves is leadership training. So for many of you who are already aware of the HealthLinks approach, it currently includes assessment, recognition, advising, and connection with local resources. The new things that we've added to this project is leadership training using the principles that I just discussed, as well as a culture assessment. And the process for businesses who join this study is to join HealthLinks as usual, do the online business assessment, do the HealthLinks advising sessions, but also we are offering employers the ability to have all employees complete a health and safety culture survey to really understand what employees think about what businesses are doing around their policies and programs. And the cool piece of this project is that we're adding total worker health leadership training, which is for a small business owner or senior manager. And the training is more in depth than what I just went through, but they learn about the skills in the training. So the first step, like I mentioned, is the HealthLinks business assessment, which helps businesses understand what they're doing sort of on a programmatic or a policy level. And once that's complete, businesses go through a couple of advising sessions with our trained total worker health advisors in our community. But what's the couple of new pieces that are involved in this project is trying to get at the employee view. Now, as employees, if we think about our environments, we're very perceptive about the relative priorities amongst competing goals in an organization. So we can really tell if a business values our health, safety, and well-being, or if it just values production. And we can tell what's reported and supported in practice. And we can really tell the difference between inconsistent words and actions around health, safety, and well-being. And the idea is that leaders, the way they interact with their workers really constitutes the primary source of information of what's important in an organization. So if we have leadership that really values health, safety, and well-being, and they communicate that value, and they're using those 5 leadership practices that I just told you about, you're likely to see a really positive health and safety culture. And so as part of the study, we are offering businesses a culture survey that's very comprehensive, and it's look at things as it pertains to an organization's general organizational culture around stress, work-life balance, job satisfaction, but also a deeper dive into what employees think about health and safety in the organization and whether or not they actually think that their business values their health, safety, and well-being, and what are their own practices and motivations for participating in those programs. The survey is anonymous, so all employees will be sent a link to participate in the survey, and we analyze the survey data and hand you a report, just like when you complete the HealthLinks business application, you get your scorecard. We're also going to analyze the culture survey data for each business that participates so they can see where they fall. And as it pertains to leadership, our leadership training is for one senior leader in an organization, the owner or a senior manager. And in this training, it's taught by experts from the University of Colorado, including me. And we have in-person and online components sort of to help businesses understand their assessment data that they're seeing, the HealthLinks business assessment, the culture survey, their own leadership self-assessment, and integrate it into an action planning step, and have some follow-up touch points with us to see how it's going, connect with other like-minded business leaders, et cetera. Like I mentioned, it's data-driven, so every business will get assessments at the business level from all employees and from the senior leader that participates. So our Small Safe Well study is really a chance for businesses to not only benchmark their health of their business and their employees through the HealthLinks business report card and our health and safety culture survey report, but also to get advising and training, both from our local HealthLinks advisors in Colorado, as well as the Total Worker Health Leadership training that covers the 5 skills that I just mentioned in more detail. It's also a chance to get recognized for all of the awesome work that you're doing for health, safety, and well-being, and a chance to connect with other like-minded businesses in the community. I will mention that if you are a Pinnacle policyholder, the cost of HealthLinks is covered through December of this year. You just have to use that coupon code there, Pinnacle Wellness, on the business assessment payment page. So with that, I am done. If anyone has any questions, I'm happy to answer them. I'm also happy to chat offline if someone would prefer that as well. Michelle has my contact information and can share that with you.
Thank you, Natalie. That was great. As you highlighted, leadership is very important to any organization for creating a successful and sustainable program. So thank you for taking the time to join us. For those of you that are on the webinar today, we do have time for questions, so you can go ahead and type them in a chat box if you'd like to, and we can answer them for you. And then, as Natalie said, I will send out her contact information in a follow-up email along with the link for this recorded webinar, and then the slides will also be shared as well in a PDF version for you so that you can go back and read the notes through them. And I just wanted to highlight, while we're waiting for some questions to come through, that the strategies that Natalie showed for us, the 5 different strategies, it just relates back to what we commonly hear when we work with businesses one-on-one. And I think I love the note. She did a presentation for this yesterday, and she was explaining that anybody can be a leader. So we talk about, in our in our assessment, it highlights CEOs and managers, and obviously those are the big decision makers, and they have to play their part and model the way and be passionate about all of this. But even if you're just entering into a position at your workplace, you can be a leader too, and it comes down to these 5 strategies. And I think everybody has the ability to display leadership and to promote health, safety, and well-being. So even if you're not that CEO or owner and you're on this call, I think it's important to remember that you have a lot to contribute as well and can do a lot by following these strategies. Natalie, I know one common question that we get from businesses is if you are one of those lower level employees and your manager may not be on board with everything or passionate about it, how do you go back and get leadership buy-in?
It's always hard. I think what works, and it depends on the situation, is using those leading up skills. By doing everything you can in your power, which is you can lead by example, you can know what your values are, you can engage other people beyond just your immediate supervisor. Maybe it's a coworker, maybe it's someone in another department. Sort of build that coalition of other like-minded individuals who have that same passion and who do role model and do want to take the time and effort to take some risks and experiment within your sphere of influence to try some things out. And then I think, especially when you're talking to senior managers or owners, data speaks, for better or worse. And I think things like the HealthLinks business assessment and the culture survey can be really eye-opening for a senior business leader to see where they fall. We did a total worker health leadership training with 4 businesses here in Colorado in August. And what was really eye-opening for the owners that were in our training was for them to see their culture survey report. In one instance, a lady from the healthcare industry came in and she didn't know what to expect from her culture survey assessment, and she was just praying that it would match what she felt like she put into the health and safety program, and it did match. Her employees did feel like health and safety was valued in their business. And so for her to see that her employees actually felt that was pretty impactful. But it can go a different way, where if there's not so awesome culture survey reports, that collective sort of report or aggregated report can be really eye-opening for a business leader to actually see. Mm-hmm. Thank you. Great. I think there was one question about what's the definition of a small business from Sandra, if I'm reading it right. So our definition, we go by the Small Business Association, and we say less than 500 employees. Although we recognize that those with even 10 to 50 can be vastly different than those with 500, but we've chosen less than 500 for our small, safe, well study. Are there any other questions that people have before we let Natalie go? Again, Natalie, I really appreciate you sharing these 5 strategies. And like I said, these are key elements that we work on with businesses all the time, from making sure that people are actually listening to their employees and getting their voice in the room, and responding to that, evaluating on a frequent basis, and then even having leaders be role models. I think that's a shortfall in a lot of businesses where they launch a program, they're excited, they have a great culture, but the CEO or manager or whoever that leader is sits in their office the whole time and doesn't participate. So I think all across the board, from communicating well to sharing your passion, creating that vision and mission, these are all really great strategies and key aspects to any program, and really important for people to walk away with, whether they're focusing on health and safety or any type of program within their workplace. So thank you again for taking the time to be with us, and thank you all for joining us over your lunch hour for the webinar today. We'll let you all get back to work and finish off the week, and like I said, be on the lookout for an email from us tomorrow with all of the follow-up information and contact information for you. Wonderful. Thank you. Thank you for having me, Chef Michelle.
Bye.
Bye.